Hi everyone, my name is Chelsea Rubel and today is 6/8/2020. I'm going to be talking to you about a few things. So here are two photos of mine, non-illustrated photos. This is going to be of the thymus and this one is going to be of the mouth. It says they're healthy tonsil, but other than that, it is not illustrated. So to go over the thymus is basically a gland that sits posterior to your sternum and anterior to your lungs. It is structurally similar to, I believe, the thyroid gland. Personally, I have not seen it like up close and personal, but I have seen the thyroid gland, which I would assume structurally looks similar to this. When you think about function, the thymus produces T cells, which is your body's cell that helps to fight off. It's basically like your antibody or your white blood cells. Similar to your bone marrow, it is the only other place where our bodies produce the T cells. So then we have, we have this photo of the mouth. The pharyngeal tonsils aren't shown in this photo. It's really just looking at the palatine tonsils and the uvula. The pharyngeal tonsils are considered the adenoids. They really sit posterior to the palatine tonsils and a little bit superior, right where like the nasal, right below the nasal pharynx area. They are lymphatic tissue that has basically like all the fine cilia over it. It helps to move that bacteria from that comes in or is breathed in through your nose down. The cilia grab it and then it works its way down into your throat and then into your stomach, so then the stomach acid eats it away. It's a really helpful lymphatic tissue that grabs all of that bacteria so then it doesn't travel all over your body. Both the adenoids and the tonsils can become inflamed and infected, and if this often happens, then you will have a tonsil and adenoidectomy. So then when I think about innate immunity, I think about your body's first initial response to infection. Normally that infection comes from a cut in your skin. It can also come from like bacteria in your mucosa. So that your innate response is going to be basically your body's first initial fast-acting response to that bacteria. Then when we think about adaptive immunity, we think about like that second line of defense. It happens a few days later compared to the innate, which is really quick acting. However, it is where those T cells come to play. So adaptive immunity is going to be like where the T cells and I believe B cells come to fight off your defense for anything that's kind of left over. So then when we think about active immunity, we're thinking about what your body does actively within it. Naturally, your active immunity is going to be like a pathogen or an immunity that comes from, an immunity that comes from a pathogen where your body kind of holds on to that immunity. So basically, I would say like you get the chicken pox. You don't get an immunization for that. You get the chicken pox and your body forever tells you you're not going to get the chicken pox unless you get the shingles. But that could, I assume, be a good example for active natural immunity. Then when you think about active artificial immunity, then you think about something that is introduced, something that you're injected with, a vaccine that is given, and then your body is kind of prolonged to that response or that immunity through active. When you think about passive is more the artificial, more of the artificial immunity. the artificial active is going to be a short-term immunity that is going to be injected into you. They provided an example, but I wasn't really familiar with that example, but I would assume that it's a short-term acting antibody that is injected into you. And then passive, like the natural way, would be from the placenta, where that antibody is coming, or that immunity is coming from the mother to the fetus. And then they have that passive natural immunity. So then when you think about HIV, so HIV, it really affects the T cells. HIV breaks down those T cells. It kind of like just eliminates them, so to speak. It takes them over, so then no longer will you have that immunity of those T cells, which makes it so that the body doesn't have enough of a fighting defense for like the common cold or cancers. There's a lot of things that T cells help with, and when you have HIV, it's really a breakdown of those T cells, so then you don't have that line of defense. So I think I went over everything. All right, thanks.